morning, Philippines. You're watching the Business Portal, your gateway to health and beauty trends and opportunities. I'm your host, Dr. John Cenica for What's Up, Doc? Yes, we have a very good, interesting topic all about varicose vein. There is a treatment for varicose vein which is non-surgical. But before anything else, I would just like to introduce to you my co-host, a fellow of the Philippine Academy of Aesthetic Surgery and the Chancellor for the Philippine Academy of Medical Specialists, a member of the Philippine Academy of Non-Surgical Aesthetics. No other than, of course, the good-looking guy, my partner, Dr. Ken DALISAY. Good morning, Doctor.
Good morning, Dr. Cenica, and
Yes.
thank you again for that very kind introduction. And nice, it's really nice to be back here again as your co-host.
Yes, thank you very
so
much
for
too.
that.
Yes, and I know that you're very busy for the past few weeks, huh?
It's manageable.
Yeah.
I'm happy to be busy. You know,
Thank you very much.
just
That
like
would be
anybody,
good.
anybody else.
I can say he's one of the icons in cosmetic surgery in the Philippines. Huh?
Thank you.
Yes, but before anything else, Dr. Dalisa, I would like to introduce to you our guest for this morning.
Yes.
She is I could say, the Associate Fellow of the Johnson Cosmetic Surgery, member of the Philippine Academy of Non-Surgical Aesthetics, no other than Doctora Evangeline AVANA. Good morning, Doctora.
Good morning.
Doctors,
Yes.
televiewers.
Yes, and our other guest is a Associate Fellow of Johnson Cosmetic Surgery, member of the Philippine Academy of Non-Surgical Aesthetics, no other than Doctora Jet CAPUCHINO.
Good morning, Dr. Jan and Dr. Ken.
Yes, we have two good-looking beauty queen look-alike, huh?
Yes.
Doctor. They're doctors, okay?
Para
And-
lang yung mga guests natin last week.
Right, oh.
Beauty queen.
Mga beauty queens. But right now, we have a very interesting topic. It's all about sclerotherapy. By the way, Dr. CAPUCHINO, what is sclerotherapy?
Sclerotherapy is a non-surgical treatment for varicose veins. Bali ito is an alternative to the surgical treatment for sclerotherapy na dating ginagawa, like which is venous stripping. In sclerotherapy, which is a non-surgical treatment, ito is nag-inject tayo ng sclerosant to the damaged veins. Tapos, this will cause inflammatory reaction to the veins and then causing it to fibrose or titigas hanggang itong vein na ito will be absorbed by the body.
Right. Dr. AVANA, is this done in the operating room or is it an outpatient procedure?
Actually, this can be done in a office setting. And after this, the patient can already go home. So there is no downtime, sir. Yeah.
How?
So walang masyadong preparations, unlike before yung sa vein stripping, di ba? You need the operating room or tsaka may peklat siya, Dr.
Right.
Cenica, yung
This
vein
is
stripping,
just infiltration of the sclerosing agent
or the irritant, para
directly into the varicose veins.
from
And you said that this is non-surgical. And sometimes they call it yung lunchtime treatment. Yes.
So ganun kabilis i-treat yan, like ganun katagal para ang sa pasyente.
Yeah.
Actually, it only takes about 15 to 20 minutes. Then you can go back to your usual routine. You can go to the mall, or if you can go back to the office if you want.
So
It's even shorter comparing to sa pag-facial, Kasi pag
para ka na din nagpa-facial, no? Or having like mga diamond peel, things
Well,
like
I
that.
would say mas mahaba pa yung consultation kasi consultation
Exactly.
nag-explain tayo 15 to 20 minutes na yun. Minsan 30 minutes pag maraming questions yung mga pasyente. And
Correct.
then the procedure for sclerotherapy would last for like 15 minutes, right?
15 minutes, wow. That's how fast it is. Huh?
Is it painful? Para
Masakit ba po to?
Usually, there is a minimal pain. Yeah, but it's very tolerable. Yeah.
So that means that ano bang how old is the patient that you done with this kind of treatment?
The oldest that I've seen is 76 years old.
Wow, 76. So
did you advise the patient to undergo a Doppler test first before?
Well, the patient who came here, meron na siyang Doppler exam, Doppler ultrasound, kasi the patient is diabetic and she has a symptomatic deep venous vein thrombosis na. Tapos, Pag mga gano'n naman pasyente, saka lang naman magre-request ng Doppler ultrasound pag yung patient is showing some, or kaya may mga signs and symptoms na.
What does a patient feel for somebody who has a varicose vein?
Patients usually complain of leg pains, leg cramping, tapos restlessness, and fatigue.
That sometimes I think they feel like akala nila is an arthritic pain or maybe a muscle pain, but rather the varicose vein itself is the one that gives the pain.
Yeah,
See?
especially during prolonged standing.
Oo. Ano ba, Dr. Abano, ano ba ang mga nito, causes of varicosity?
Actually, the cause is unknown, but the contributing factors that lead to varicose vein, 50% of it is usually hereditary. Other factors may include, depends upon the nature of the job. If you're on prolonged standing, prolonged sitting, yeah.
Sino mo itong mga prone dito? Yung mga sales lady, di ba? Parang
Security guard.
security guards, right? Oo. Nurses, teachers, even
Even
doctors.
as surgeons. kapag
Surgeon,
yung
because
procedures,
pag-prolonged surgery ka, of course, mga 3 to 4 hours na nakatayo ka.
That's the reason why I have some surgeon friends na they use the stockings.
The stockings,
Oo.
during
Para,
procedures.
oo.
So, parang lahat yata ng trabaho affected ng nagiging cause ng varicosity. So,
Yes, sir. Actually, almost 50% of the population, 80 millions, were affected of this varicose veins. And usually it affects women.
women.
How about taking contraceptive pills?
Yes, sir.
Yeah,
It may also, hormonal pills, those who are pregnant, obese patient, they are also, yeah.
Eh, sino bang,
After giving birth, maybe.
halos sa mga tao nila, lahat overweight na. No?
Yun ang naging problem ngayon ng Philippines na before
Yeah.
payat na mga
Oo,
tao.
mga
Kasi
malnourished ngayon, ano
ngayon
na.
ang naging problem yung obesity na. No?
Right. Oh. Now, when you say sclerotherapy, or we call it a non-surgical treatment of varicose veins, so that means that there's no surgery.
No surgery.
Now, and the treatment is like 15-20 minutes?
Yes, sir.
Oh,
So it's
okay.
basically needles, right? Needles.
Does this varicose vein, after the treatment, ito ba, nagkakaroon ng recurrence?
The treated varicose veins, nawawala na yun permanently. Ang nangyayari lang kaya nagkakaroon ulit, parang may lumalabas na sa ibang site. Oo. May tumubong bago.
Okay.
But there's no way na babalik yung treated na. Once na treated, eventually ma-absorb na.
Permanently, hindi na siya babalik.
Yes. By the way, if you have any questions to our guests regarding varicose veins, the non-surgical treatment of varicose veins, you can text our cell phone number at 0922-891-6761, and please indicate your name and your cell phone number, and of course your location where you are right now, and we could answer your question regarding varicosities. Yes.
So, gano'n kadalas kailangan gawin yung sclerotherapy? Yung interval, yung
Yes.
scheduling?
The treatment, usually, we do it once a week. So, if patient come this week, next week ulit yung next session nila.
How about the what do you call this, yung mga post procedure instructions, like uwi ba nila, may mga bawal ba? Ano yung mga kailangan nilang
Wala
tandaan?
siyang bawal. You can, sabi ko nga kanina, you can go back on your normal routine. Tapos, after 2 hours lang, we just advise the patient to get yung tape na nilalagay natin, to remove it after 2 hours.
Oh, we have a texter, Dr. Dalisay, from Izan Mazo from Davao. Sabi niya,
Malayo to, Dr.
malayo. Is this only a one-time treatment, or we have to go back to the clinic, Doktora?
Ayun, sakto, yung tinatanong natin, yung scheduling, paano ba yung interval?
Right.
Usually, when the patient comes for the first time, ina-assess muna natin yon, no? Kinukunan muna natin ng medical history, and then we assess kung ano yung extent ng varicosities nila. But usually, yung treatment, hindi pwedeng isang treatment lang. Usually, about 2 to 10 sessions. Depending, kasi it depends on the reaction of the patient. And the extent of the damage naman, oo. Mhm.
Yes, I understand this varicose vein. You don't harbor this overnight lang eh. I mean, siguro there's some patient who had varicosity for like maybe 5 years, 10 years, and then they just appear. And of course, the treatment, you said that's like 2 to 10 treatment. So you're talking like around 2 to 10 weeks. But maybe siguro more than that pa if there's a... Depends siguro sa severity, no? Sa severity.
Depends pa naman, sir, dun sa extent ng damage ng patient.
Oh, okay. Right.
Baka meron sa sobrang dami kasi papawala pa lang yung iba, may tumutubo ng bago kasi baka ganun siya ka ano.
Okay, we have again another texter from Pelan of Cavite. Ang sabi niya, good morning doctors, what's up doc? Ang varicose vein po ba ay yung malalaki lang ang tinitreat nyo o yung maliliit lang? Kasi siguro mayroong spider veins tsaka yung bigger veins. Ito po ba ay nakukuha ng tinatawag na procedure na sclerotherapy? Dr.
Yung
Capuchino?
varicose vein, meron tayong tatlong klase. No? We have the varicose vein, yung talagang malalaki. These are yung parang tortoise veins na malalaki. And then we have reticular veins and spider veins. Lahat yung tatlong klase na yon kayang i-treat ng sclerotherapy.
Okay, okay.
At
Right.
saka actually, doktora, hindi lang siya na-address natin dyan na problema. Not only the cosmetic part, the aesthetic part, kundi medical problem kasi rin to, ano? Hindi lang siya eyesore, ano?
Right.
Pero usually kasi ang mga pasyente natin when women came, no, yung mga babae, ang usual complaint naman nila usually is the aesthetic part. Yung dahil hindi makapag-shorts, hindi makapag mga micro-mini, mga ganyan. Dahil
Especially,
maraming
oo.
ugat-ugat.
So, totoo ngayon kasi alam mo yung maraming yung, especially pag nagba-badminton ka, and then of course, napakapangit naman siguro kung if you're wearing a jogging pants na nagba-badminton, tsaka manti mo, mainit yun eh. Nasa beach ka, it's summertime, nahihiya kang mag-wear ng bathing suit or a two-piece, and you get a lot of varicose. It's a social problem also eh.
And even semen, Dr. Cenica, ngayon masyado silang, I heard na magiging stricto.
Pero
in terms of
how many
sa mga varicosities.
percentage of the women have been affected by this kind of... Kasi mostly, ano to eh, either babae tsaka lalaki eh. Mas marami ba ang affected na babae o mas maraming affected na lalaki?
Mas maraming babae na affected, oh.
True. And then kasi women has always been exposed. Sabi nga ni doktora, if you're taking hormonal pills, if you're taking overweight also could be one cause of varicosities. And pregnancy, ayaw na naman, pregnancy. Lahat puro babae na lang na-apektuhan. Parang ay mas vain pa naman ang babae. And then, of course, the women will be wearing two-piece. Tapos may varicose vein ka. So, nahihiya silang to wear those mini skirts and bathing suits, right? And, for varicose veins, I know this is a social problem. You said that this is not about the treatment. The treatment, so masakit ba ang treatment during sclerotherapy?
Actually, sir, case-to-case basis eh. There are some na medyo nasasaktan, may iba din na hindi rin. It depends dun sa nila.
The pain tolerance of the patient.
Right, right.
How about in terms of dun sa mga complications naman? Ano yung mga kailangan?
Mga possible,
na ma-explain sa pasyente na dapat malaman nila before starting
Yes.
the procedure.
Yung mga complications ng sclerotherapy, usually bruising, minsan may hematomas, hypersensitivity reaction, yung mga allergies. Manageable naman ito.
So you have
Parang
to...
minor lang pala siya, mga bruises, parang...
Especially if it is done by a well-trained cosmetic surgeon.
Wow, okay. Now, Doktora, when you say varicose vein, of course, is everybody candidate for varicosity? Or who are the people who can be eliminated na hindi pwedeng i-treat? Oo, sino ba to?
Patients that are contraindicated sa treatment, usually these are patients na may mga deep venous vein thrombosis, mga may superficial or systemic na active infections, of patients with uncontrolled diabetes. Ano po ba?
Patient who are, siguro yung mga paralyzed patient.
Tapos mga patients with heart problems like angina.
Oo, yung mga na-stroke na pasyente kasi
Pero ang
kasi alam ko when you do sclerotherapy you have to move, you have to walk eh. That's part of the post-op regimen.
Usually, madalas tinatanong ng pasyente na can we walk after the procedure? Actually, mas maganda pa nga yung lumalakad-lakad, diba?
Yes, yes.
Oo.
Okay, we have a question here from Naga Bicol. Bicol, no? From Blandino Bandola. Okay, ano po ba ang mga paraan kung paano po maiiwasan ang varicose veins? How can you prevent varicose? From Naga, from Blandino Bandola.
Usually, if you want to prevent varicose veins, dapat first is you have to wear comfortable shoes. Pag sa mga babae, dapat we advise yung 1 to 2 inch heels lang. Tapos, doon naman sa, kasi we can't avoid, sir, lalo na pag ang nature ng trabaho mo is yung prolonged standing, prolonged sitting. So, if you have time, dapat mas maganda, you have to elevate your legs.
Elevate your legs.
So, it really helps. How about using stockings?
Yes, it also helps. Yung compression.
Not only to hide the scars, no?
Right.
Pero nakakatulong.
Pero wala, according to them, there is no scar eh. Scarless, it's just probably injection.
I mean, yung mga girls na may yung mga piso-piso, they call it piso-piso yung mga scars, no? So by using stockings, yung compression stockings, nakakatulong hindi lang para ma-hide yung mga ano nila, mga problema sa skin, kundi para din pala mag-compress yung varicose.
Right. Doon ba sa inyo sa Janssen, do you have a lot of patients in sclerotherapy?
Yes, sir. Maraming patient kami sa Janssen na pumupunta. Usually, yung mga seamen natin, pumupunta sila sa Janssen para magpa-treat kasi records.
Bakit kaya, ako, I also encounter a lot of mga seamen na, mga seafarers, no, na nagkakaroon ng varicose vein. They'll probably because of their orientation sa trabaho. When I interviewed them, sabi nga nila kasi nagbubuhat sila na mabibigat eh. Kasi syempre there's pressure on the legs, kaya nagkakaroon ng dilatation of the varicose veins and compression, kaya nagkakaroon sila ng varicosity. So hindi din siguro advisable for a patient na if you are weightlifter, kinakailangan magsusot ka rin ng mga compression stocking, no? Na parang hindi magkaroon ng varicose veins. Yun ang sa tingin ko, no? Oo.
Tsaka one of the reason also, Dr. Cenica, maybe yung prolonged standing din. Kasi meron silang tinatawag na minsan na-interview tayo yung pag-guardia sila, things like that. Parang talagang nakatayo sila kasi parang guard din ata.
Even yung mga, alam mo yung mga truck drivers or mga van driver, kasi syempre, prolonged sitting naman yon, no? Palagi nakaupo sila at least 8 to 10 hours. Sa taxi nga, pag taxi, 12 hours eh.
So it's actually any prolonged position na hindi nakapag-circulate ng maayos yung dugo, ano?
Right.
Ang pangit pa kasi dyan sa varicosities kapag yung mga late stage na rin, magkakaroon ng discoloration of the skin sa lower extremities. Kasi hindi na maganda kasi yung circulation ng ng dugo.
Yeah, yes. Okay, we have a texter again from Quezon province. Alam ko Quezon City. His name is Ariel. Okay, mahal po ba magpa-treat ng varicose veins?
Ito, Dr. Cenica, yung mga ganyan question hindi nawawala yan yung cost.
Yung cost palagi, no?
Actually, yan ang mga tinatanong ng pasyente. Akala kasi ng pasyente yung mga aesthetic procedures pang high-end lang, no? Hindi nila alam na pwede naman kahit sino, no? Yung cost ng first treatment natin, very affordable. Parang isang cellphone lang na hindi masyadong high-end, no? Oo, mga ganun lang, no? So, pwede bang sabihin, sir, yung actual price na?
Actual price? Siguro pwede, we can anyway. It's very affordable naman, no?
First treatment natin is 4,000 pesos. Then the succeeding treatments, your second, third, fourth, ganun, is only 900 pesos.
Parang
naglo-load ka lang ng cellphone. Wow. That's not bad. The price not bad.
From high-end to pwede naman, no?
And as I've said, it's actually two birds in one stone, di ba? Kasi ang ina-address nating problem dito is not only the aesthetic problem, kundi yung medical din.
We have a question again from Bikutan, from Bienvenido del Mundo. Okay? Ang sabi niya po ay, ito ho ba kinakailangan, do you have to be absent in school or at work when you do the treatment?
No need po. Hindi po kailangan mag-absent po kayo kahit nga magsaglit lang kayo. Pag break nyo, pwede kayong pumunta kagad sa clinic namin. Kasi sabi nga namin kanina, it only takes about 15 to 20 minutes yung treatment. Then wala po siyang downtime. So anytime, you can go home, you can go back to your normal routine po.
That's the reason why they call it
lunchtime treatment, no? Lunch break, pwede na. And
Pwedeng isingit,
babalik ka
ano?
sa trabaho. Well, anyway, we still have a lot of texters and Dr. Dalisay, and maybe later on we will demonstrate how the procedure is done, you know, through our in the clinic. And Dr. Dalisay, standby lang tayo, and we'll be right back when WhatsApp Dot returns. Yes, and we're back here in What's Up Do. Of course, we are with our guest and, of course, my co-host, Dr. Ken Dalisay from the Philippine Academy of Aesthetic Surgery, and, of course, a consultant in Johnson Cosmetic Surgery. And, of course, we have two young and beautiful lady physician from Associate Fellow of Johnson Cosmetic Surgery, Dr. Evangeline AVANA, and, of course, Dr. Jet CAPUCHINO. And our discussion is all about the non-surgical treatment of varicose vein. But before anything else, if you have any questions or any comments, you can text us at 0922-891-6761, and please indicate your name and your location where you are at right now. Okay,
And
so
just keep on texting, and we'll be more than happy to
Yes.
answer your questions.
correct. Right now, varicose veins. Again, do you need to be hospitalized, you know, when you undergo this kind of treatment, sclerotherapy, Doktora?
No, walang hospitalization na kailangan pag sclerotherapy because this is sabi nga natin kanina, it's a lunchtime treatment. So, pagka-treat sa'yo, pwede ka na ring umuwi agad or bumalik sa trabaho mo.
Okay, so how many injections per visit
Do you need?
ang kailangan or ang pwedeng gawin?
The number of injections will depend, of course, dun sa ma-assess namin kung ilan yung mga makikita naming mga damage.
Depende sa severity siguro. Yes. So, because I know na minsan kasi there's a combination of the yung mga greater saphenous vein insufficiency, yung malalaki talaga, no? And that can be treated, Doktora AVANA, yung mga malalaki, as in parang ganyang halos yung laki ng thumb.
Yes, sir. It can be treated. Kahit yung mga maliliit nga na makikita natin, matitreat po yun.
Siguro they will be needing a compression bandage after the...
Yeah, do you need that after the treatment, a compression garment?
Yes, we do usually the compression bandage, lalo na pag mga malalaki. Yung talagang varicose talaga siya. So, we
So,
usually...
yung nakikita natin sa video, may tinatakpan siya ng bulak pagkatapos ng per injection, right? Okay, this is what's the purpose of this cotton balls, as compression or something or what? Yes, just to cover up the wound.
Siguro aside from dun sa pagbilid, syempre medyo matutusok ka ng konti. And
Plus, of course, we have to apply
compress na rin siya ng
elastic bandage for this
So
patient.
para makompress na konti and then yung inflammation, parang didikit. Is that right?
Yeah. Tsaka para yung gamot na rin, sir, hindi siya lalabas kaagad.
Correct. Now, how do you start treatment of varicose veins? Is that like, do you need like a special test for this, or how do you do? Let's say a patient consulted you for sclerotherapy. Anong unang ginagawa natin?
First, when patients come, syempre kukunin natin yung complete medical history nila. Then we do the PE, physical exam, and then we ask the patient to stand in our platform. Tapos, we assess the severity of the varicose veins.
And of course, what kind of, you said that you have like two kinds of medicine, which is the weak sclerosing agent and the strong sclerosing agent,
We have two kinds ng sclerosing agent. The major one is the sclerodine. This contains iodine. That's why when we do the history taking, we ask the patient kung meron silang allergy sa mga seafoods, ganyan. Because this medicine has iodine. Oo.
That's the common component between the seafoods and then dun sa sclerosing agent, which the sclerodine.
And then, yung isa naman, the minor sclerosing agent is yung sclerodex. It contains sodium chloride and dextrose. We can use this sa mga spider veins, telangiectasia, saka some reticular veins.
Yung bang mga pasyente, pwedeng makakapag-expect ng after each treatment, may improvement naman?
Improvement ka agad?
May
When
come back for
yes.
follow-up, may makikita.
Kailan nila makikita yung result?
Actually, the first treatment pa lang, makikita na nilang may pagbabago na. Especially when yung mga telangiectasias, usually nawawala agad yun eh. Sa reticular veins, saka yung mga malalaki, yung mga varicose veins, it needs several treatments. Pero first treatment na lang, may makikita ng
May makita ng
Although
changes.
siguro may mga exceptions yun dahil sinasabi nga natin, minsan yung medicine kasi, it's not an exact science.
Yes, right.
Meron din kasi mga
It's a
failures.
case-to-case
Pero,
basis naman eh.
But mostly, after each treatment, talagang may makikita. Maliban na lang kung medyo malas na lang na kasama siya dun sa hindi maganda yung pag-respond ka.
How about
It is very,
those patients na may mga yung mga skin diseases? Is it a candidate for varicose veins? Like for example, who have like eczema or something?
Usually, sir, pag may mga ganyan, may mga skin diseases, usually gina-advise muna namin na let it heal, pagalingin muna. Kasi nga, syempre, pag may sugat siyan, mag-a-add ka lang din ng injury, trauma, infection, and prone to infection especially. So usually, medyo dinidiscourage muna namin yung mga ganong klaseng patient. Then after that, pag medyo gumaling na, then that's the time na to come back.
Since hindi naman kasi siya emergency case.
Okay. Again, Dr. Dalisay, we have a texter from Quezon City, from Jam Swansing. Okay. Meron po akong mga spider veins sa mukha. Pwede ko po bang ipatreat ito sa clinic ninyo from Jam Swansing? Tora.
Yes, you can come to our clinic. Yung mga facial, yung sa face, opo. Meron pong mga pumupunta din po doon. Yes, we can treat.
Maraming may mga ganoon eh. Minsan kasi sobrang nipis sa
Actually,
mukha.
yung spider veins sa mukha not only in sclerotherapy, pwedeng address din yan with CO2 laser, Dr. Cenica.
Pwede rin, no?
Kasi pag burn kasi yun. Even yung maraming technology.
But mas madali ang sclerotherapy dahil sa injection mo doon, minsan mawala na.
Particularly dun kasi ang use niya eh.
Minsan kasi pag CO2 laser, nababurn pa damage yung skin eh. Ito, walang damage to. O yan, Miss Jam Swansing, pwede na pala yung spider veins mo dyan sa face mo, yung mga veins mo through
O ano ba yan? Baka
sclerotherapy.
naman nalipat lang yung leg sa mukha o akala niya.
Hindi naman, siguro talagang kasi even though how much makeups or foundations ang ilalagay mo sa face, hindi pa rin mawala itong mga
So,
mga
you can't hide eh. Minsan hindi mo talaga hindi matatago talaga.
Especially yung mga Caucasians, medyo akala mo mamula-mula talaga yung mukha nila. Pero actually, there's some mga parang
Yeah, I've treated several of these who have veins in the face eh. And kung gano'ng kadami minsan yung varicose vein nila sa legs, gano'n din kadami yung sa face. So, is it painful ba pag sa face naman? Is that the same treatment that you are doing for the legs?
Just like sa legs po, sometimes yung sabi nga natin kanina, it depends dun sa tolerance ng patients. Opo. Some patient, medyo nararamdaman nila, yung iba naman, hindi na, parang wala lang.
So ito ba kailangan ba kumpletuhin talaga yung course ng treatment? Like for instance, ako, OFW ako, I have only like 4 to 6 weeks here in the Philippines. I mean, I don't have the luxury of time to stay for the treatment.
Yeah.
So pwede ko bang iwan na hindi pa siya tapos, hindi pa completely eradicated or completely eliminated yung varicosities ko? Okay lang ba na tutuloy ulit when I come back?
Mas maganda sana talaga if kung makumpleto yung treatment, but if in that case na hindi talaga natin ma-avoid, mas mainam na rin yung maumpisahan na natin.
Correct. At least they started something for the legs rather than doing nothing. So how much percentage do you think that if you treated your varicose vein, is that a 100% may eliminate or probably 70 or 80%? Ang elimination ng varicosities.
Yung elimination as long as they follow up every week. Basta every week lang talaga sila nagpa-follow up, sir, 100% matitreat yun.
Okay.
Kailangan lang ng cooperation at saka
So kailangan kasi yung patient compliance. Compliance is very important. Any kind of disease naman compliance is very important when you do the treatment. So now, yes, we know that varicosity is also a problem wherein it doesn't look aesthetically doesn't look good. But first of all is that it really gives pain and sometimes they mistaken it for arthritis pain. For those diabetic patients who are, or let's say for example sa borderline, or for those patients who have like a hyperthyroid patient, will you do treatments for them or you do a clearance first for their doctors, for their primary physician to have the treatment of varicosities?
For patients like that, especially those with diabetes, usually we ask them to have clearance first with their doctors. Kasi mahirap na yung baka mamaya uncontrolled yung sugar nila. Oo.
Once you had this wound, minsan baka hindi gumaling. Hindi siya gumagaling.
Kasi usually, sir, there are patients who came in the clinic, no? Usually pupunta sila, sabihin nila hindi controlled yung sugar ko. So mahirap nang
You have to double check din kasi minsan sabihin nila.
Ginagamit lang nila yung glucometer nila sa bahay.
Tsaka let's say if you have like a FBS determination or yung mga test for sugars, yung pala 1 year ago na yun. Tapos yun na nagiging basis na, mababahunon ko. Kailan mahuling treatment nyo? Last year pa, kinakailangan yung recent at least 1 month before the treatment.
Actually, alam mo itong sclerotherapy, it's being covered by the health insurance.
I didn't know that.
HMO. Kasi sabi ko nga, hindi lang to eyesore, hindi lang for aesthetic reason kaya natin pinipito.
Correct.
Medical problem kasi siya. And this is the reason why kino-cover nila sa insurance. Kasama yung Actually, din sa mga ginagawa ng mga doctors in aesthetic world, ang naka-cover din ng health insurance yung Dr. Cenica, yung mga wart removal and sclerotherapy, yung varicose vein yan, kino-cover nila yan kasi health problem din nga siya.
I see. Again, Dr. Dalisay, we have a texter from here from Rhea U. Dale of Bacoor, Cavite. Ang varicose vein ho ba ay natitreat without the sclerotherapy? I mean, ito ba ay gumagaling to ng kusa without sclerotherapy siguro, ganun?
Hindi. Kasi yung varicose veins, these are damaged veins na, no? So, hindi yan nakukuha ng yung iba ginagawa, warm compress. Yung, siguro, nare-relieve ka lang ng pain ng konti, pero nandun pa rin yun. Treatment is your sclerotherapy. Oo.
So, kailangan talaga matanggal na yung problematic na...
Let's say, for example, you already venous veins insufficiency with sclerotherapy. Biglang nagkaroon ng heart problem or kailangan sa ng bypass, coronary bypass. Where can we get the veins? I mean, natanggal na natin yung varicose veins dito.
Well, siguro, Dr. Cenica, kahit hindi ako ang tinatanong mo, since nakatingin ka sa akin.
Yes.
In my personal point of view. Kasi hindi mo naman na rin magagamit itong...
Exactly. Yung varicose vein. These are diseased veins already. No?
Kasi damage na siya. It's problematic. Why are you going to use it?
Correct.
Problema na talaga siya, di ba?
Correct. So that means na those varicose vein cannot be used for bypass surgery.
Yung gagamitin.
Hindi na pwede. Kasi isa disease vein Tsaka dilated na yan Because this is also one question din sa akin isang mga doktor na di pa paano na yan. Wala na tayong gagamitin na vein para just to, let's say, if you had a heart surgery, magkaroon ng coronary bypass, tinanggal nyo na. Hindi naman kasi this varicose veins are already a disease vein. Damaged vein na po yan. Hindi na po gamitin yan sa surgical procedures.
Kasi meron tayong tinatawag na one-way valve. So nagkaroon ng insufficiency, pwede bumalik
Correct.
Why are you going to use it?
A varicose vein. Correct. It sounds, may sense, no? Now, these patients na sabi nyo nga, it only takes like 15-20 minutes. Is that per session? Yes,
Yes, per session.
But is it okay? Because you have said earlier na ang interval niya kasi for schedule is weekly. That's weekly basis, no? What if yung pasyente coming from the province, medyo hassle naman for them na to go back weekly. Is it okay if yung schedule nyo every 2 weeks?
Let's say every 2 weeks? Pwede.
Sometimes hindi kasi ma-avoid na may mga ganyan tayong pasyente na nanggaling pa sa mga malalayong lugar. So, wala tayong magawa doon kasi nasa kanila. Actually nga, yung effectiveness nun talaga, pwede. Nasa compliance nila.
What would be the post-op advices that you gave to the patient who undergone sclerotherapy? Post-op advices. Yung mga pagkatapos ng procedures, kinakailangan ba nakahiga sila o kinakailangan bang magpahinga?
You could say post-procedure instructions.
Instructions.
Actually, after the procedure, we just advise the patient to walk. Yeah, it's very important. Opo. Tapos, then we advise them to remove the tape after 2 hours. Then kasi in some cases kasi we put elastic bandage lalo na pag dun sa mga malalaking Tapos we advise them na to remove only the elastic bandage pag natutulog sila o kaya pag naliligo sila.
Right. It's very important kasi akala ng pasyente, habang minsan may pasyente nga ako habang kahit naliligo, nakalagay yung elastic bandage eh. Oo. At,
Pero actually, there's no problem siguro with dun sa mabasa eh. Ang pangit lang yung bandage. Babaho naman siya.
oo nga. The only thing you gotta do is just probably change the elastic bandage after that. Hindi po natin ina-advise na ilagay yung elastic bandage kahit naliligo. So, dapat alisin din yung elastic bandage during, sabi mo nga ni doktora, pag natutulog ka, baka kasi nag-inip ka, biglang tanggalin mo,
Pero siguro kung matitiis naman ng pasyente, it would be better din if it would stay there for like 48 to 72 hours na di ba? Ngayon, kung hindi siya masyadong komportable, hindi naman masyadong malaki talaga, siguro sa gabi pwede tanggalin.
Now, a lot of patients have been worrying about the pain, again, there's a texter, kaya tinatanong ko. Pag galing po from Parañaque, from Juris o Parañaque, sabi niya, pwede ho bang lagyan ng anesthesia ang pasyente during the process of treatment because probably she's worrying about the pain. So, kinakailan ba lagyan ng anesthesia pa yan?
We do not put anesthesia, no? Kahit topical, hindi. Kasi ito naman, yung pain naman nito is very tolerable. Saka kapag naglagay ka pa ng topical anesthesia, baka mamaya magkaroon pa ng reaction dun sa gamot, no? Pag nag-inject ng gamot.
Oh, that's good. So, hindi na kailangan ng anesthesia,
Very tolerable naman to eh. So, okay.
Ito ba, ganong kalalaki bang needle ang nilalagay natin dito? Ano bang in-inject natin? Kasi siyempre, when you say needle, parang, ganon ang reaction ng pasyente. So, ito ba itong mga needles na to? Ano ba to? How big it is?
Maliit lang to. Gauge 30. Masyadong maliit yun.
Ito na yung ginagamit ng mga dentist di ba? Gauge 30 needle. Hindi mo mararamdaman. So, you don't need to apply any topical or local anesthesia during the process of the treatment. Now, again, the pain is really always been a question. Ang sabi niya, meron mo bang pain pagkatapos ng treatment?
Yung pain, usually masakit yung ng konti, yung pagpasok ng needle. And then, pag yung mga malalaking, yung mga varicose veins, usually sasabihin ng pasyente, masakit yung pagpasok ng gamot. Of course, ganun talaga yan, no? Kasi
Ano naman siguro, doktor, nakakita ng pasyente yung naiyak o napasigaw dahil sa masakit? Wala naman.
Usually talaga, yung iba nga, nagte-text lang, nakikipagkwentuhan, parang wala lang. Oo.
Nakakipag-text, So, hindi mo kinakailangan ng local anesthesia. I think ang kailangan mo dito vocal anesthesia. Vocal anesthesia
Kinukwento mo lang para
kinukwento mo. Para ma-relax yung pasyente. Iba yung local tsaka vocal anesthesia.
Hindi mo naman siguro kailangan sumayaw para ma-divert yung attention.
Hindi naman. Then it's very important also while doing the treatment, you have to talk to your patient. Kasi one thing more, nagkakaroon pa kayo ng magandang bonding and then yung patient, doctor's patient relationship, yung rapport nila, develop. That's the new trend of treatment right now in medicine, para sa tingin ko, ganun. Na you have to develop a good relationship with the patient, wherein the patient will be very comfortable with you, and at the same time, they even bring their patients.
Yung trust and confidence mas umaakit.
Kahit nararamdaman na nila na masakit, kung kinakausap mo sila, nadadivert, nawawala. So,
At saka siguro kapag nakita na nila yung improvement, the next time around, when they come back for follow-up, hindi nila iisipin yung konting nararamdaman nila kasi they are happy with the result.
Yes, okay. Again, we have a texter from Julius of Pampanga. Yung pong mga bisita niyo, mga doktora, magaganda po. Saan po sila pwedeng malaman ang kanilang addresses? Or maybe later on, we will...
taga Pampanga kayo, doktora, mga
baka magkano yun, di ba? Yes, kasi sinasabi na magandang ating mga, of course.
Bakit sa atin, Dr. Cenica, parang walang compliment?
Mamaya later on, baka mamaya meron.
Sa pa lang, hindi naman.
Text na lang sa atin sa personal cellphone number natin. At kung, let's say, we want to get in touch with you, where can you get in touch, Dr. Jet?
We are located at Jansen Cosmetic Surgery, second floor, Midland Plaza Hotel, Adriatico Street in Manila, besides Robinson's Place, Ermita.
Yes. Telephone number, Doktora? It's 521-1444. It's easy, di ba? Oo. And actually, we're here at Janssen Cosmetic Surgery, Manila branch. And we have 5 branches, doctor.
We have also one in Pampanga. Actually, 2 branches in Pampanga. One located in Balibago, Angeles, Pampanga. The other in Marquee Mall. And we also have one in Biñan, Laguna.
Which will be open tomorrow.
Tomorrow, yeah.
Oh, we're inviting all all of the people, taga Biñan and from Laguna, the whole province of Laguna. It's in front of Perpetual Help of Biñan Hospital, and it's a newly renovated place in Laguna. Will be the icons there of Biñan.
Place for relaxation and treatments ng mga minor na katulad nito.
Right. Oh. And we're inviting the Republic of the Philippines to come to Janssen.
Meron tayo sa Quezon City.
In Scout Borromeo. Yes, Scout Borromeo. And you know the telephone number there?
I forget about the telephone numbers already.
Email. Oh, you can email us at jansencosmeticsurgery.com, and we have a Facebook account. Janssen Cosmetic Surgery, and you know that we have also a Facebook account, the WhatsApp Doc. Yeah. So you can also log in our Facebook account, WhatsApp Doc. Yan ang title natin.
Bago ba yan, Dr. Cenica?
Bago yan. Oh, yeah. You can start liking it. Yeah. Yeah, you can start liking it. And of week, of course, Ken DALISAY for hosting for 2 consecutive weeks. You know, here at Janssen. You see the flowers that has been given by our sponsor, Lunis.
Parang gusto mo dito na Dr. Cenica.
Oo nga eh. Oo. Yes. Oo. Very refreshing. Of course, the staff of GNN, Global News Network, si Arnel, si Cora, and of course, our doctors here again, Dr. Evangeline AVANA and Dr. CAPUCHINO. Thanks for guesting in our show. And it will be very educational. A lot of people have been texting us to know about the non-surgical treatment of varicose veins. Okay? And of course, for our televiewers, again, you will see us next week for our new topic in aesthetic medicine and surgery. And of course, we're also inviting the doctors naman. Whatever specialty you have, either you are a general practitioner, family medicine, or OB, internal medicine, surgery, if you want to learn about the non-surgical procedures, like non-surgical aesthetic procedures like yung botulinum toxin and mesotherapy, radiofrequency, sclerotherapy, and we have our workshop on July 21 and 22 at Cherry Blossoms Hotel. It's here in Manila, in Ermita, and you can call 522-4303, and you can ask for Clark regarding the workshop. It's a 2-day workshop, and you will learn about it's a hands-on training in non-surgical procedures like yung botulinum toxin, RF, lahat po ng non-surgical procedures, and all the doctors are invited regardless of specialty. Again, thank you very much, doctors. Thank you very much, Dr. DALISAY. Hope I can invite you again in the future.
It's my pleasure. I'm looking forward to it.
Yeah. You look good, huh?
You too.
Thank you very much. Again, this is Dr. Cenica for What's Up, Doc?